based on the various causes of a disease. It could be a virus, could be a bacteria, could be a parasite. They present with different signs and symptoms.
Right.
But the most common ones are usually fever, headache. You get to even coughing itself, difficulty in breathing. So it has different ways of presentation. But importantly, whenever you get to you get such symptoms, because you might not know what it could be, then it's always the best way to go to a medical profession, so that they can be able to, to actually take your complaints, get to know what the problem is, get to do the tests. Because actually brucellosis itself has specific tests. So depending on the disease and the test that the doctors or the clinicians would be able to do, then a diagnosis would be arrived upon. So once the diagnosis is arrived upon, then you can be able now to treat the correct, disease.
And there was someone, somewhere I was reading that, because it's you've noted it well that some of these zoonotic diseases, they emanate from the animals to the human beings. That when you are bitten by ticks from the animals, you should probably preserve that tick. You go with it to the hospital so that they know the direct, of course, probably the best diagnosis for you. How is it? Because now, assuming you are bitten by a dog or any other animal, should you also preserve this to also go to the store?
Okay, so once you are bitten by any animal, for example, a dog, a tick, it's always important to take measures. Back there at home, I can relate with that. Someone is bitten by any animal like a dog, but they do not take any step, for example.
Sure.
So it's always important, not to keep the the dog or the tick that bitten you, but it's good to take the step of now going to any healthcare facility to report it. Then from there you can be able to be guided on the next steps.
Right. Yeah. Now, maybe on the same note, of course, it's another interesting thing is, some of these zoonotic diseases, because you're actually associating with an animal that just by the looks it is so healthy, but just something unfortunate, of course, happens, and then the disease, the infection is transferred from the animal to the human being, where the animals look so healthy. Of course, it's just healthy when you get to look at it, but now you get infected by a disease. So what really gives this disparity? Could it be our genetic, the genetic makeup of the human beings are different from those of animals, that an animal could be infected with a zoonotic disease, but then it's not exhibiting any symptoms, but then it gets to you, and then explode everything. Now your system gets to know.
Okay, so just the way let's say human beings behave, at times you are infected but you do not present with the particular symptoms of that particular disease. It's the same way as to, let's say, when an animal is infected with a zoonotic disease and it is actually a carrier. We call it a reservoir host. So they might not typically present with their condition as it is, but once it gets to you, and let's say you are the people that you've talked about, the immunocompromised, the elderly, and also the young children below 5 years, then you are able to, your immunity cannot be able to fight that actively. Then of course you now present with the symptoms. But of course our genetic makeup plays a little role in terms of now that particular cause.
All right.
Yeah.
Now, of course, now because we are talking about diseases, and these are diseases, of course, that having risk factors, it will also be important that we get to talk about the prevention measures of some of these diseases. So, what are some of the mechanisms, measures that can be enacted to prevent, infection by these some of these zoonotic diseases?
Yeah. So important because for everything that happens, it's always important to know what can I be able to do? So yes, these zoonotic diseases are preventable. So from the risk factors that I've mentioned before, well, when you're handling your pets or your animals at home or wherever you are, of course, handle them with care in terms of now hygiene. Whenever you're handling, for example, your cows back at home, handle them with hygiene. Ensure that you keep, washing your hands, for example, and minimizing the contact as well. And also, if for example, a cat or dogs as well, those that you're having them at home, then it's always important to have them not, around your plates, because once they lick food from your plates, then that can also be a mode of transmission.
Right.
Yeah. So yes, it's preventable. Yeah.
All right. Now, as we're winding up this discussion, because tomorrow we shall be commemorating, of course, now this day, the World the World Zoonoses Day.
Yeah.
What message would you be having for the general public concerning this awareness day of zoonoses?
Yeah, sure. So tomorrow is a very important day, the 6th of July, the World Zoonoses Day. So the messages I would want to pass across are three. One, get your pets or your animals vaccinated, so that from this you can be able to prevent, for your animals from being infected. And if you prevent your animals from being infected, then you can be able to prevent the human beings from receiving the disease. Then the second one, get yourself vaccinated. We have, for example, the rabies vaccine available. Then ensure to take it up once you you're bitten, for example. And the third one, support anyone with a pet shelter, so that you can be able to have this, as a multidisciplinary approach towards the prevention of transmission of this. You can remember that, for example, this particular virus, COVID-19, the way it has brought various negative effects to both our countries and even to us individuals.
Right.
So from that and from the experience that we have as a country and even as individuals, then we clearly know that it's really better preventing it than getting to now being sick. So that's my parting shot. Yeah, so prevention is the way to go.
All right.
Yeah.
And thank you so much, of course, for your input, Daktari.
Thank you so much.
We get to learn a lot, of course, about zoonoses, a lot of things that we didn't know.
Yeah.
And surprisingly, you talked about, the point of vaccination is very important.
Sure.
Are there also vaccines for, when you're introducing this, you talked of vaccines for rabies?
Yeah, they are actually. Rabies vaccine is actually available.
Okay.
And, it's actually pre-exposure. You're protecting yourself from getting rabies.
Right.
Just the way COVID vaccines as well work. Yeah, so it's actually available in the country.
Of course, it is a conversation that we shall be continuing with online tomorrow, as the whole world will be commemorating this day, the World Zoonoses Day. And without, we're taking a very short break. We shall be coming back with more. Stay with us.